The CDC just released a recommendation to avoid all large gatherings or events with over 50 people for the next 8 weeks due to the spread of the coronavirus. The new term that is being thrown around is called social distancing. What does that really mean, and is it even helpful? We'll address this and more coming up. Welcome to Family Med. I'm Dr. Richardson, and this is your home for practical and accurate information to help your family make healthy decisions. This is a channel that focuses on being better health to your home. Now, like the rest of the world, here at Family Med, we've been focusing on the coronavirus. This is a story that is rapidly evolving, so we'll be giving updates along the way on this and other topics. So make sure you follow along with us here by subscribing and hitting that notification button so you don't miss out on the latest information. Like much of the country, today is the first day of my kids' unplanned vacation from school. We didn't go to church yesterday because we've been asked to do our worship at home. I probably enjoyed the last track meet of my son, who's a senior in high school this past week. No more NBA games. And for the first time in about 10 years, my college team was going to get into the NCAA tournament, and now there's no tournament. Concerts, plays, and other large gatherings are suddenly no more. Travel to and from Europe is no longer. And the only place you can see people now is either at Walmart or Costco. I think we're just all in a little bit of shock. And the new phrase that has caused all this havoc is called social distancing. It's probably become a bitter word in the mouth of many, but should it be? Why are we doing this, and what does it mean for you and your family? Social distancing is the concept of avoiding human-to-human contact as much as possible during a time of an outbreak. The overall concept is really simple. If you aren't in close contact with somebody, then chances are you won't get sick. And if the virus can't spread person to person, then it goes away. And if there's one thing that this world needs right now, is for that virus to go away. This is a proven technique used to minimize the spread of outbreaks such as the one that we're experiencing. The classic example of the effectiveness of social distancing came from the 1918 Spanish Flu Epidemic. This was a devastating epidemic of influenza that killed over 800,000 people in the United States and over 50 million people throughout the world. There were two cities that had two different reactions to the outbreak. One was Philadelphia, where, ignoring the warnings of influenza cases, they decided to hold a parade to celebrate soldiers who were preparing to go to World War I. Over 200,000 people crammed together to attend the parade. 3 days later, every bed in Philadelphia hospitals were filled with the sick and dying patients because of the Spanish flu. By the end of the week, more than 4,500 were dead. By the time the city officials closed down the city, it was too late. Now, in contrast, we can look at St. Louis, Missouri. Within 2 days of detecting the first case, they closed the schools, playgrounds, libraries, city buildings, and even churches. They staggered work schedules and limited mass transit. They banned meetings of people for more than 20 people. Now, as a result, they were able to keep the number of deaths to half that was found in Philadelphia. Social distancing worked. It worked because it was implemented early. Now, in our current situation, we're seeing the same exact scenario play out. We have the examples of China, Italy, and Iran versus the countries of South Korea, Hong Kong, and Taiwan. For China, Italy, and Iran, these countries were caught unaware, and before they could implement significant distancing policies, they had a much higher infection rates and death rates. South Korea is a great example of implementation of social distancing. They quickly were able to slow the rate of infection by closing schools, canceling public events, and encouraging significant social distancing practices. As a result, the infection rate has leveled off, and the death rate is much lower than the other countries. So what can we do? Well, the first thing that we need to do is recognize that this is indeed a problem. As we have gotten more and more information with this state-changing story, we're seeing that the coronavirus is definitely a serious threat. Even in my past videos, I try to draw some comparisons between the flu and the coronavirus. I still think it's helpful to draw such comparisons because it's something that we can relate to. The problem I'm seeing, though, is that when we compare the flu to the coronavirus, some take the attitude of, well, I don't care about the flu, mainly because I don't believe in flu shots. And since the flu and the coronavirus are similar, I'm not going to care about the coronavirus either. That is a most dangerous attitude that we can have. Let me show you a graph here that came from an article from the Business Insider. Now I know it's not a reputable medical journal, but hear me out. I looked around and found that the data they are presenting is pretty accurate. What it shows is a good comparison between the death rates per age for both influenza and the coronavirus. As you can see, the death rates for COVID-19 are much higher than that of influenza, especially for those over the age of 50. Now, these rates are likely to go down over time, mainly because we're able to test a lot more people for influenza than we are for the coronavirus. Those who were counted in these numbers tended to be more sick to begin with and were more likely to be tested. Regardless though, even taking that into account, the numbers are much more significant. So please, don't just dismiss this as a bad flu. So now that we know how serious it is, how do we help? Well, the first thing we do is pay attention to how we're feeling. If we're sick, we need to make sure we're staying away from others. We shouldn't be going out into public. In fact, unless we're really sick and need care, we shouldn't even go to the doctor and should take care of our symptoms at home. Now, certainly this is something you should be calling and talking to your own doctor about. And most importantly, we need to stay away from those who would be at higher risk. The next thing that we should do is abide by the recommendations being put out by the CDC and local health departments. We should be avoiding large crowds. This means church, conventions, school in most areas, and even large shopping areas we should avoid as much as possible. We need to keep our distance from others. This means hugging and handshakes should be left for our immediate family members. Now, as much as possible, we should try and work from home. And if you can't cook, ordering takeout is better. Avoiding crowded restaurants and bars is also very important. We should try to limit non-essential travel. As well, we need to avoid close contact with those who are at higher risk. And if you are at higher risk, then keeping yourself from close contact with others can also be helpful. Now, most schools are closing, but if we treat this as a time for vacation and travel all over the place, then we're defeating the purpose of closing down. One of the most concerning things about this disease is that many who are healthy can carry it with minimal to no symptoms. That means that we can inadvertently spread it to our loved ones who are at higher risk and prolong this outbreak. So what are some practical implications of this? Well, it means if you're a grandparent, maybe you should reconsider watching your grandkids for a while. Visiting may be best done through electronic means. Maybe instead of going to the gym, you should work out at home or outside. Maybe we should avoid play dates for the next little while. And instead of taking your kids to the grocery store, you should go by yourself and practice good hand hygiene before and after. Now, if you're planning weddings or other special events, you may want to consider postponing them or making them much smaller or simpler events. All of these things require extra effort and sacrifice on everybody's part. And the hardest part about all of this is it feels like we're really overreacting. I know this weekend, as we follow the discussions about whether they're going to close our local schools, it was really hard to feel like it was justified closing them when we just had our first 5 cases here, and 4 of those 5 are recovering easily at home. We just don't feel the pressure and the gravity of it because we aren't seeing the consequences of it. We need to remember, though, the example of Philadelphia and St. Louis back in the 1918 Spanish Flu Epidemic, as well as the current examples of Italy versus South Korea. With this virus, once we start seeing concerning signs, it's already too late to get ahead of it. We need to take steps as individuals and a society to stem the tide of this pandemic. Fortunately, the additional information about this disease we've been getting has given us tools to better protect ourselves. My hope is that if we can all implement these simple steps, we can protect our families and those most at risk. I hope that a month from now, because we've all taken this seriously, those who are crying out that this is an overreaction will be saying how right they were, because we were able to prevent this outbreak from getting worse. As we have all learned at this point, this is a rapidly evolving story, and there are a lot of things that we still just don't know about it. As things progress, we'll provide some updates in the future as we learn more. Now, so you don't miss out on it, make sure you subscribe to our channel and hit that notification button. And if you have your own questions on this virus outbreak or anything else, make sure you let us know in the comments below. We'll try to answer it in a future video. So until next time, this is Family Med with Dr. Richardson. And remember, take care of your body, because it's the only one you have.